both in the private sector and in the public sector, it's estimated we waste about $600 billion a year. I mean, in unnecessary costs and unnecessary tests and just poor management of the healthcare system. A big chunk of that is because we don't emphasize prevention. Our healthcare system is not designed for prevention. That's why I call it a disease care system. We wait until people get really sick, and then we have these very expensive medical interventions. So, for example, many insurance companies won't reimburse you for a dietitian so that you can control your weight, but they will reimburse for a $30,000 foot amputation once you get diabetes. Right? That's just an inefficient way of running a healthcare system. So what we do is we incentivize both in the work that we're going to do with the private sector, but also in the government plan that I'm setting up, as well as Medicare and Medicaid, emphasis on prevention. Emphasis on primary care doctors who right now are much less are paid much less than specialists. Emphasis on regular checkups, regular screenings. That means, by the way, you've got to have access to a doctor. You've got to have access to a doctor. And that's important in rural communities in Indiana and Illinois where a lot of primary care physicians aren't located. We've got to manage the treatment of the chronically ill more intelligently. We've got to use health information technologies to reduce bureaucracy and to improve quality. If we do a combination of these things, we can save, let's say we don't save $600 billion, we're not going to squeeze all the inefficiencies out of the system, but we can conservatively save $100 to $150 billion a year, conservatively. And when you combine it with the money that's going to be generated with rolling back the Bush tax cuts on the top 1–2%, then you actually have enough to provide the subsidies for those who don't currently have care. And over time, what you're also doing is controlling healthcare inflation, which will have benefits for Medicare and Medicaid, which are the two biggest budget busters in the federal government. If our obesity rate went back to what it was in 1980, we would save the Medicare system $1 trillion. That's how much of the increased costs in Medicare and Medicaid are accounted for by higher heart disease, higher diabetes rates, all things that we could control if we were providing more prevention on the front end.